Hello, I'm one of the respiratory therapists from Midwest Medical, and today we're going to go over how to set up and use a cool humidity to trach system. Have all the supplies and equipment that you need right here, and we're going to start with the compressor. The compressor is what's going to deliver the air that's going to be humidified to your patient. First thing you want to do is make sure that you have the compressor either on the floor or a flat, sturdy surface. You're going to plug your compressor into a wall outlet. On the back of the compressor, there is a filter. I'm going to pull this out and show it to you. It's a foam filter. This is where your air inlet on the compressor is. The filter is keeping dust and particles out of the compressor. So you will need to take this filter out and clean it whenever it looks dirty, or at least weekly. You're going to rinse it out under the faucet, squeeze it out, let it air dry, and then once it's dry, you're going to pop it right back into the back of the compressor. Now on your compressor on the front, you have your on-off switch, which is down here on the bottom. You also have your knob for adjusting your pressure. It's a locking knob, so when I pull it out, I'm able to do some adjustments, and when I push it in, it's going to lock, and it's going to keep it wherever you set it, so it can't accidentally get bumped or pushed. Over here on this side where this elbow piece is, this is where your air outlet is and where you will connect your water bottle. So I'm going to turn this on and show you how you will adjust the pressure. You'll want to pull your locking knob out so you'll be able to adjust the pressure. You're going to turn the compressor on, and then you're going to block your air outlet with your finger or your thumb, and then you can adjust the pressure and set it where it needs to be. Typically we will run this right around 50 psi. That's the best place to set it to get an adequate amount of aerosol coming through your water bottle for your patient. So I'm going to turn it on. It's going to make some noise. And that's where you can adjust your pressure, right on the knob there. Okay, the next thing we're going to do is prepare our cool aerosol jar to be connected to the compressor. You're going to twist off the top of the jar, and you are going to fill it. There's a minimum line and a maximum line that are a little difficult to see here on the camera, but you're going to want to fill it with either distilled or sterile water, and you're going to fill it somewhere between those lines. Typically the best place to fill it is up to the maximum line, but no higher than that. The next thing you're going to do is twist the cover of the jar back on, taking care not to cross-thread it. So when you're turning it on, you want to make sure that the lid goes on nice and straight. If you do happen to cross-thread it where it's crooked, you can easily unscrew it and fix it. So on the top of the lid of your aerosol jar, there's a few things I want to show you. There's some numbers and a dial up on the top, and there's a little indicator right in between these two white pieces. You want to make sure that the 100 is lined up with your little indicator, and that's where you will want to leave it set. There's also two caps that fit in to the top of the jar. You want to make sure that these are in. You don't really need to take them out for any reason. Just make sure that they're twisted in tight. All right, so I'm going to attach my bottle to the compressor. Again, you're going to twist this on. It's threaded, and you need to take care that, again, you're not doing any cross-threading. And when you twist this on, it should go on nice and straight and tight, and you can see your bottle is hanging straight. If you look closely here, you can see that it's twisted all the way up to the top, and you won't see any threads. If you have all that done, you know that it's on nice and tight, and you won't have any problems. You won't have any air leaking out. All right, so now we're going to connect our tubing up to the aerosol jar. What you're going to have is this blue aerosol tubing, which typically comes in a large roll, and you're going to cut this to the length that you need to go from the jar to your patient. if you take a look at this closely, you can see that the tubing, the aerosol tubing, comes in sections. And when you're cutting this, you want to take care to cut it right in the center between the sections. There's like a little bubble that sticks out. You want to cut it right in between the bubble. If you don't cut it right there, it's going to be difficult to connect all your pieces. So that's the best way to do that. So I'm going to connect the aerosol tubing to my jar. I already have this cut. So the next thing I'm going to do is put a drain bag on. Now you're going to get some condensation, some water collection in the tubing, and the drain bag is connected so that you have somewhere to collect that. Now when you're putting this on, you're going to want to make sure that the drain bag is hanging in a down position. You don't want it twisted so it's up or sideways, because then you're not going to be able to collect any water. So when this is going to your patient, make sure that it's hanging downward so that all the water can drop into the bag, and then you're able to empty it. So I'm going to put another length of tubing to the other side of the aerosol tubing, and then I'm going to connect my trach mask, which is then going to go to my client, to my patient. All right, now sometimes you're going to need to add oxygen to this system. And in order to do that, you're going to have an adapter where you're going to bleed your oxygen in. So you're going to have your oxygen source, and that you're going to have oxygen tubing leading from your oxygen source to this adapter. You're going to twist the oxygen tubing, push it on so that it's nice and tight, and then your oxygen adapter can go right off your aerosol jar. So you'll have your jar, your oxygen connector, and then your blue tubing. So that's the best way to connect that if you're adding oxygen. Now, all the pieces, or all the tubing, the jar, all your adapters, are all disposable pieces. So we usually recommend that that's changed either weekly or every 2 weeks, depending on how you would want to do that, what your protocol is. So you would just throw that away and put on clean tubing. I hope this has been helpful for you. If you have any further questions, please give us a call here at Midwest Medical at 763-780-0100. Thank you.